I want to go back to like something that was mentioned in the earlier panel about taking more intellectual risk. I'm curious if you can comment as to what would that look like in the field of cancer that patients and clinicians can start to see as like tangible outcomes of that taking more intellectual risk posture?
Well, part of the issue of risk is some are going to fail. So we can't hold the standard that every one of those things has to score if it's a high risk. But I'll give you an example of a high risk proposal that we're pursuing that you'll hear more of in the coming months, which is cancer vaccines. Okay. Now, cancer vaccines are very different from vaccines to prevent infection. When you're using vaccines to prevent infection, you're often vaccinating a population of healthy people. So you got to be really sure it's a super safe vaccine. In the case of cancer vaccines, you're talking about someone who likely has an expected survival of less than a year, okay? Very different population, so you're willing to do more innovative things and take greater risks, okay? There's a lot of cancers where the treatment starts with initial operation, let's say pancreatic cancer, so the pancreatic tumor is removed, but we know there's a very high risk of recurrence. Most of the people recur, and most of the times they will die of their tumor.
Just the idea of using our immune system to attack cancer was a radical idea in the 1990s when I was a medical student. And it took a lot of intellectual courage to get to the point where you could even try them. Frankly, I think it just took too long. And now what you're seeing is the fruition of these ideas, of which I'm really hopeful that they'll pay off with big advances in how we treat really intractable cancers. So that's a success story of a risk taken. Let me give you another story of a cancer approach called anti-angiogenesis. In the late 90s, so this is a drug that prevents your body from producing blood vessels. Cancers are fed by blood vessels. In fact, one of the things that solid cancers often do is send out signals to your body to produce blood vessels because they need to get fed. Right? And so the idea was that anti-angiogenesis drugs would potentially solve all solid tumors. That was the promise I remember hearing in late in medical school. Right.